Hello, everybody, and welcome to the Tuesday edition of Video Clips, brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. You probably have already noticed that the schedule has changed. You're getting fewer emails from us than you used to. We decided to streamline our emails to just once per week. And so on alternating Mondays, you'll receive a newsletter, and alternating weeks for a video on Tuesday or Thursday. I'll also send a newsletter to members of the Make Americans Free Again organization every other Friday. And the reason for this is it just seems that the more email we send, the less attention people pay to it. And the whole reason for sending email is so that you pay attention to it. So I'm hoping that less turns into more where this is concerned. First, a big announcement. We're having a virtual book launch party on Saturday, November 8th at 2:30 p.m. Eastern Time. It'll be via Zoom, so any place, anybody, any place in the world can participate. It's not just for members, and it's free. Heidi and I will read a couple of what we think are super interesting parts of the book, and then the rest of it will just be allocated to discussion and asking questions. So if you're reading the book, think of all the things that you want to ask Heidi and I, and be ready on November 8th to ask us some questions. So anyway, super excited about my book. Please buy it, recommend it to others. If you have the time, write a review on Amazon. That helps move us up in the ranks, which is super helpful. And if you order one through the office, I'll autograph it for you. Okay, so I have three topics to cover today. A little bit more substantive since there are fewer videos, I'll do more in each video. So the first one is some important information about your microbiome and a recommendation. It's well known that the body can clear medications within a few hours to a few weeks. However, the damage to the microbiome from many drugs persists for a much longer time, sometimes years, and the damage is dose dependent. In other words, the longer you take some drugs, the greater the negative impact. Most likely, you already know, I think everybody does, that antibiotics are incredibly damaging to the microbiome, but a lot of other commonly prescribed drugs also destroy beneficial bacteria. Research shows that antidepressants, beta blockers, steroids, drugs to treat reflux, benzodiazepines, and the diabetes drug metformin also have an adverse impact on gut health. In fact, taking benzos and antidepressants cause damage similar to that caused by antibiotics on the microbiome. Research also shows the most alarming thing was the cumulative effect. The microbiomes of people with a history of antibiotic use never fully recovered, regardless of how long ago the last dose of antibiotic was taken. The effects of various drugs differed. Some shifted the balance between pathogenic and beneficial bacteria. Some, like NSAIDs, changed immune function or weakened the gut lining, leading to increased inflammation and increasing the risk of leaky gut, which is kind of ironic when you think about it. NSAIDs are supposed to reduce inflammation, but they actually ultimately increase the risk of inflammation. Beneficial antidepressants in particular altered energy production. Under normal circumstances, when your microbiome is in good shape, the beneficial bacteria break down fiber and other indigestible carbohydrates and turn them into short-chain fatty acids like acetate, propionate, and butyrate, which are then absorbed back into the system, and humans use these for energy. Antidepressants interfere with this mechanism. The impact on children is especially striking, particularly in response to antibiotic use, and includes increased risk of allergies, asthma, and metabolic disorders like type 2 diabetes. When you take into consideration that the average child takes about 18 rounds of antibiotics by the time he or she graduates from high school, it's truly frightening the condition that these kids' microbiomes and immune systems are really in. A high fiber plant-based diet can help with recovery, but for most, particularly if your diet hasn't been the best or you've taken a lot of prescription drugs in the past, additional help may be needed in the form of probiotics. Many of you know that for many years, we have offered probiotics to our concierge members, tailoring the products to the person's health issues and history. For the first time, we're going to offer a solid product that benefits most people to anybody who thinks their gut might need some help. It requires no tailoring. It's made by a company I have a lot of confidence in, the Juice Plus company. So I hope those of you who are distributors are already taking it. Those who are connected to a distributor, I suggest that you purchase from them. Those who are not can order through us. We can have it shipped directly to you, and the company will allow you to pay in 4 installments to make it super affordable. So if you'd like to do this or you want more information about it, email me at pampopper@wellnessforum.com, or you can call us at 614-841-7700. So everybody can get probiotics through Wellness Forum and its associates out in the field. Okay, on to the next topic. Another reason to become informed about health so you're not harmed by the system has to do with low back pain. We've been telling people that the best way to get rid of low back pain is yoga for almost 30 years right now. If you establish a regular practice, low back pain goes away and it stays away as long as you practice. And by the way, if you don't have a yoga practice, we have been offering yoga classes weekly through the Happy Healthy You Bootcamp, and you can still sign up for that and watch the videos, and then you'll have access to the videos and the classes for as long as you're a member of Wellness Forum, if you're a member. But many people aren't told about yoga, and they're told that surgery is the best way to get rid of low back pain. Surgery is often ineffective, or it can even make back pain and mobility worse instead of better. A new analysis focused on high-volume hospitals that perform at least 500 spinal surgeries per year and discovered that these institutions performed collectively 200,000 unnecessary surgeries. You heard that right, 200,000, which cost close to $2 billion and paid for by Medicare. Not only were the procedures unnecessary, there were significant complications. About 18% of spinal fusions resulted in infection, blood clots, stroke, pneumonia, heart and lung disorders, and sometimes even death. The institutions that were the worst offenders for spinal fusion were Mount Nittany Medical Center in Pennsylvania, Concord Hospital in New Hampshire, and Lutheran Hospital in Indiana. The worst offenders for vertebroplasty were Kettering Health in Ohio, Shannon Medical Center in Texas, and St. Elizabeth Florence Hospital in Kentucky. And in these cases, sometimes over half of these procedures resulted in serious complications and even death. Now, one of the reasons this caught my eye is I have a particular interest in this topic. Back surgery happened to be the beginning of the end of my mother's life. I watched the consequences. She had an ill-advised surgery. The doctors screwed it up. She was one of the people with side effects. She had another surgery supposedly to correct it, and then she never walked again. And I'll say this: my mother was not particularly motivated to be proactive for herself, but the bottom line was the descent into hell, and that's what it was. 20 years of hell started with an ill-advised back surgery. So I can tell you from personal experience what that looks like from a family perspective. So if you have low back pain, don't consent to surgery. Get yourself in a yoga class, ours or somebody's. But that's how I resolved my own back pain, because I sure as heck was determined not to go down the path that I saw my mother go down. The third topic that I want to talk about, 40% of Americans are now obese. They're not chubby, they're not overweight, they're obese. Obese people are some of the most abused and mistreated by the medical system, the worst example being the currently prescribed weight loss drugs, which don't work and worsen obesity over time. I mean, people who take these drugs lose muscle mass. And I put out a video a few weeks ago and showed statistics that the average person who takes them as directed and stays on them for a year or two is still obese at the end of the year or two. And most people don't make it to 1 year. They stop taking the drugs because of the god-awful side effects, or they can't afford them anymore. Well, here's a reason to really work on getting yourself lean the right way. Obese people are at higher risk of 13 cancers, which collectively comprise 40% of all cancers in the United States. And I'm going to give you the list of them. Some of them are hard to treat, and the fatality rate is very high. Esophageal cancer, postmenopausal breast cancer, colon and rectal cancers, uterine cancer, gallbladder, kidney, liver, ovarian, pancreatic, and thyroid cancers, and multiple myeloma. As I mentioned, some of these have very low survival rates, making prevention, which involves weight loss, the best and actually the only viable option. The overall mortality rate for these cancers tripled between 1999 and 2020. And of course, during that time, the number of obese people in our country increased quite a bit as well, to the place now where there's 40% of the population in an obese state. I know it seems simple, but diet and exercise are the only way you're going to become a lean person. And this often involves addressing psychological state, lack of confidence, and all kinds of other issues that stand in the way of progress, which is why I started Winner's Circle last year, an 8-class series that helps people figure out themselves and their barriers to having success. It's a program that I took super expensive, which I distilled into a much simpler form that's a whole lot less expensive, less than 20% of what I paid for the course I'm taking. And it's a way for you to learn more about yourself and get rid of your barriers that keep you from becoming healthy. The first class and the last series I'm teaching this year has already taken place, but you can watch the recording and join us for the second class if you'd like to. So I think 3 important news items to share with you. I hope you'll pass this on to other people who need to hear this stuff too. Members, don't forget that you can gift a basic membership to a friend or family member if you would like to for the foreseeable future. People are starting to do that, which we're super excited about. Another thing, since we're talking about the microbiome more, we have this new product. I'm going to offer a free microbiome workshop on Monday, November 10th. I'm going to go into a lot more detail on this subject. It'll be at 8 p.m. Eastern. We'll record it. There'll be a limited number of people we can have in this. I know it's going to attract a lot of folks, and you can invite friends and that sort of thing, because this microbiome issue is super, super important. Just a couple more things. Don't forget to buy and read my book. It's the blueprint for how to solve our national health crisis. And I'm going to ask a favor of you guys. I've spent the last 5 years of my life helping a lot of people and putting aside a lot of my own things that it would advance my life in order to do that through our nonprofit and organizing people to fight back against medical tyranny and public health overreach and that sort of thing. So I'm declaring the last quarter of this year the time of the era of Make Wellness Forum great again. And you can help us by buying my book, buying our bars, using our smoothie mix, referring friends, give away a free membership so that somebody can get to know us. It would help a whole lot, because I have a lot of money to raise for Make Americans Free Again every month, and it sometimes distracts from my ability to spend time and energy on my business. So help us make Wellness Forum great. Continue to make Wellness Forum great. I don't know that we need to make it great again, but continue to make it great. I guess that's it for today. Pass this on to anybody who you think would enjoy watching it, and I will be back to you in a couple of weeks via this venue with more news. You'll get a newsletter from us next week, and we'll just alternate weeks. And I would be open to changing the schedule if interest warranted, but right now I would rather put out less and have you pay more attention than put out so much and have you not. So far that's working out okay. Give me your feedback. My email address is pampopper@wellnessforum.com. Happy to hear whatever you have to say about our schedule or what I talk about or anything else. All right, that's it for today. Have a great rest of your day, and I'll be back to you next week with more news in newsletter form. Thanks so much for watching.